So here I am in the hospital on, what is it, day 3 or day 4? That would make it, I think, day 52,000 in Michelle Malkin math. So things are probably getting pretty expensive here. It's probably into the billions of dollars in Malkin math dollars for my stay. So if you're wondering, do I always look this good? And do I always sound this good? Yeah, pretty much. This is about as good as it gets. So, I don't know how many of you have seen the video of Glenn Beck when he whines pitifully like a little pansy about his stay in a hospital and how they treat him like a poor schlub. Well, he's hardly a poor schlub. He makes $50 million a year and can afford all the insurance he wants. But see, that's the confusion here. We're not talking about health care reform. We're talking about health insurance reform. You know, if you listen to Glenn Beck one week when he's drugged up and had a bad week, we have the worst healthcare system in the entire world. And a year later, when he's, drugged up on something different, we have the best healthcare system in the entire world, and why would we want to mess it up? Well, the truth is, we have neither. We don't have the best healthcare system in the world, and we don't have the worst healthcare system in the world. What we do have is the worst health insurance system in the world. We spend 3 times as much on insurance, on treating people, as other countries, and we don't cover everybody. The CEO of United Healthcare can be paid $100 million a year. That's money that doesn't go to treat people that are sick. And all the while, we have these insurance death panels who decide, we won't pay for your treatment, your insurance doesn't cover that, you got sick, we're going to take your insurance away. That's the reality. So I see people out protesting against no public option. Go back to the 9/12 Tea Party rally in Washington, D.C. the other day. Striding up and down, yelling, no public option, no public option, no public option. What you're really saying is that when you lose your job and you lose your insurance, you're okay with losing your house when you get sick. You're okay with not having health insurance when you get sick and when you need it. That's all the public option is. There's no reason in the richest country in the world that we can't cover everybody when they get sick. So, I'm in this hospital. It's not fun. It's miserable. I've got tubes in my arm that run all the way down here to my heart. But I'm not going to sit here and whine like that big baby Glenn Beck did, because I'm getting really excellent health care and I have good insurance. But what I want is insurance for everybody. I want everybody to have what I have without having to worry about going broke, without having to worry about having it taken away from them when they get sick, without having to worry about their coverage being denied when they need it the most. That's what I want. That's what you should all want.